Welcome dear students, this is Dr. Pratyusha and let us begin learning ENT. In this series our first topic is anatomy of the ear. So ear is divided into three parts: external ear, middle ear and inner ear. So today let us learn about external ear. In the external ear, traditionally we learn by learning its anatomy. So our topic for today is anatomy of external ear. External ear is divided into three parts. It consists of three parts and they are: first part is the auricle or pinna. The second part is the external auditory canal. And the third part is tympanic membrane. I would rather say the tympanic membrane separates the external ear from the middle ear. Auricle, also called as pinna, external auditory canal, also called as external acoustic canal, and finally the tympanic membrane, which separates the external ear from the middle ear. Now first and foremost, let us learn about the pinna. Auricle or pinna is that part of the ear that assists in capturing the sound from the external environment. That is the function of the auricle. So we have two auricles, one on either side of the face. Each auricle has two surfaces, lateral surface and a medial surface. The lateral surface consists of many elevations and depressions. There are a variety of structures that are present on the lateral surface. Let us look into each one of them. So this is a beautiful image of the external ear, the auricle. This part that you can see here, the C-shaped cartilaginous part, this is called as helix. It is one of the most prominent elevations that is seen in the auricle. Another fold is seen parallel to the helix. This one, it is called as antihelix. The helix ends in a lower fatty mass of tissue that is called as lobule. The antihelix ends in lobule. Other parts that you can see here, this triangular elevation is called as tragus. And opposite to the tragus, this part is called as antitragus. These are some of the elevations that are seen on the auricle. Now, let us look into some depressions. This part over here, this is called as concha. This is an important structure because concha is a landmark for mastoid antrum while performing surgeries. There's another part here. This is called as incisura terminalis. This is about the auricle, the parts of auricle. Helix, antihelix, lobule, tragus, antitragus, and two depressions, cymba concha and incisura terminalis. Now this entire auricle is made up of a single piece of cartilage, that is yellow elastic cartilage. The entire auricle is made up of this cartilage except two parts. Cartilage is devoid in two areas of auricle, and those two areas are, one is the lobule where the cartilage is absent, and second is the incisura terminalis. These two parts are devoid of cartilage. Now why all these structures are important is because the cartilage of the auricle serves as a graft material in various surgeries. So these parts of the auricle are very important because this cartilage serves as a graft material in various surgeries, mostly the middle ear reconstruction surgeries. In those surgeries, the tragus generally is used as a graft material. Even in nose reconstruction surgeries, this cartilage can be used as a graft material. Even the lobule is used and various parts are used. So it is essential that we understand the parts of the auricle. Now incisura terminalis is another important landmark because that is devoid of cartilage, and hence we can pierce through that to enter the internal structures without disturbing the cartilage. It is one of the approach that is used for endoral surgeries. Now after having understood the various parts of the auricle, let us look into its nerve supply. Nerve supply consists of motor and sensory. There are a few muscles in the auricle, intrinsic muscles and extrinsic muscles. Intrinsic muscles are the ones that are present within the cartilage of the auricle, and extrinsic muscles come from outside. They usually come from the scalp. So these muscles are supplied by the facial nerve. They adjust the position of the auricle. So facial nerve supplies intrinsic and extrinsic muscles of the auricle. Second, sensory. Now the sensory supply of auricle is very interesting because there are various nerves that are supplying it. Pause. So if we look at the sensory supply of the auricle, this is the lateral surface of auricle, and we have three colors depicting the various areas. This part is supplied by auriculotemporal nerve. This auriculotemporal nerve is a branch of trigeminal nerve, mandibular branch of trigeminal nerve. This part is supplied by great auricular nerve, which is directly coming from the cervical plexus C2 and C3. And this green color area is being supplied by cranial nerves, facial nerve and vagus nerve, the 7th and 10th cranial nerves. And if we look at the medial surface of the auricle, this is a picture depicting the medial surface. Now look at it as if you're seeing the ear from behind. So this part is auriculotemporal nerve. Same color code is used for easy understanding. This is by the cranial nerves 7 and 10, facial nerve and vagus nerve. This is by the great auricular nerve. Additionally, we have another nerve here supplying this area, and that is lesser occipital nerve. This is also directly coming from the plexus C2, cervical plexus. So to understand, this is very simple. There is no much concept behind it. But the point is, how do we remember and memorize this? So let me explain a little bit more. Auriculotemporal nerve is a branch of trigeminal nerve, and trigeminal nerve is the nerve that supplies the entire face. Auriculotemporal, it is supplying the auricle as well as the temple. The nerve that is supplying the entire face is supplying the starting part of the ear, the first part of the auricle. So that is your trigeminal nerve's branch, auriculotemporal nerve. And next we have this entire purple color area. So if you look at all the three nerves, the maximum part is supplied by one nerve, that is all this purple area. It is great, it is supplying the greatest portion. That is your great auricular nerve. Greatest portion of auricle by great auricular nerve. And then we have a small part that is by the cranial nerve 7 and 10. Now if you think a bit more, the middle ear, external auditory canal, they are all supplied by cranial nerves. So this is the part that is leading into the external auditory canal. So from here itself, the 7th and 10th cranial nerves have taken over the area. That is their representation on the auricle. Similarly, if we look behind, here also maximum area is supplied by the great auricular nerve. And this green color area, it is exactly posterior part of what you can see in the front. The area that is supplied by 7th and 10th cranial nerve. Auriculotemporal nerve, as you can see, it is the starting part again. Additionally, just one more nerve, that is the lesser occipital nerve, supplying the topmost part of the medial surface of auricle. This is about the nerve supply of auricle or pinna. I hope with this explanation you can remember and memorize the nerve supply of various parts. Greatest part by great auricular nerve. The part that is leading into the external auditory canal by cranial nerves. And just a small part that is closest to the face region by the nerve that supplies the rest of the face, that is trigeminal nerve, its branch auriculotemporal nerve, and corresponding parts on the medial surface. This is about the nerve supply. Next, let us study about the development of pinna. During the embryonic life, at about 6 weeks, 6 tubercles called hillocks of His develop around the first and second branchial arch. 6 tubercles called as hillocks of His develop, and these 6 tubercles gradually enlarge in size and they fuse. And by about 20 weeks, they all fuse and an adult shape pinna is formed. It is completed by 20 weeks. So these 6 tubercles fuse and form the auricle or the pinna. This is about the development of pinna, and it is important because in case these tubercles do not fuse properly, it will lead to a variety of congenital anomalies. And another point to be remembered in development is the tragus develops from the first branchial arch, and the rest of the auricle develops from the second branchial arch. These points are crucial to understand the congenital anomalies of the ear. Stop. In the next video, let us look into the disorders of pinna. The disorders of Pinna could be congenital, traumatic, inflammatory, or neoplastic. Let us look into all of them one by one. First, into congenital anomalies. In congenital anomalies, first anomaly is anorexia. A generally means absence. So, anorexia is the complete absence of the pinna and the ear lobule. This is usually seen in syndromes such as Treacher-Collins syndrome and golden hair syndrome. These are the syndromes that result in craniofacial anomalies. So, anorexia is complete absence. Anorexia is complete absence of pinna and ear lobule. Next we have another condition called as microtia. As you guessed it, micro means small, otia is pinna. So microtia is a small sized pinna. It results because of incomplete development of the tubercles of the auricle, of the helix of His. So there is incomplete development and growth of pinna, and this can lead to a small pinna or sometimes an abnormal pinna also. Based on that, we have 4 grades of microtia, and they are: in grade 1, the pinna is normal, but it is small in size. Size is the only problem. Whereas in grade 2, the size is also small, plus there is some abnormality in the shape, abnormality in structures. In grade 3, there is just a vertical mass of soft tissue that is and cartilage, which is associated sometimes with the atresia of external auditory canal. There is just a vertical mass of tissue. Sometimes there can be atresia of external auditory canal. Now, a small pinna or abnormalities might not result in hearing loss, but atresia of external auditory canal definitely will lead to hearing loss. And finally, we have grade 4. In grade 4, all the external structures are absent, and that is nothing but our anorexia. The entire pinna is absent. So, grade 4 microtia is anorexia. Let us look into the pictures of microtia. This is grade 1. This is grade 2, where it is small and there is some minor abnormality in the shape, as you can see here. And this is grade 3 and this is grade 4. It is almost absent. Okay. Next we have macrotia. Macrotia is excessively large ear auricle that is disproportionate to the size of the head. Large sized auricle. If it is problematic, reduction surgeries can be performed. Next anomaly is bat ear. In bat ear, the problem is the ears are excessively protruding outside. Abnormally protruding ears are called bat ears, and this can be unilateral or bilateral. It does not cause any hearing issues, but cosmetically it can be a problem. Abnormally protruding ears. This is how a bat ear looks like. Next in the list, we have something called as coloboma of the ear. Coloboma per se means absence or a defect. Coloboma equal to defect. Coloboma is a term that we usually come across in ophthalmology, but in ENT also we have a coloboma, and that is coloboma of the pinna, wherein a small part of the pinna is absent, and that will lead to a defect like this. Here there is a defect for you to clearly see again. Here is the defect, and this is leading to an abnormality in the shape, and the helix is being crooked. This is coloboma. Next we have another defect called as cryptotia. In cryptotia, the uppermost part of the auricle, this part, the upper 1/3, is embedded under the skin of the scalp, and this is called cryptotia. Crypt is hidden. So this upper 1/3 of the auricle is hidden under the skin of the scalp, and this is called as cryptotia. In cryptotia, the upper 1/3 of auricle is embedded under the skin of the scalp. Next in the list, we have another condition that is called as cup ear. It's also called as lop ear. As you can see, the upper part of the auricle folds like a cup. It is because of the underdevelopment of this part of auricle that we see it this way, hypoplasia of the upper 1/3 of auricle. So it gives a cupped appearance. These are various anomalies, congenital anomalies of the pinna. Apart from this, we have another two conditions, and they are preauricular pits and preauricular sinuses. So preauricular pit is a small pit is seen above the tragus and below the helix, below the ascending part of the helix. And this is important because it is one of the first and easily visible sign of BOR. BOR is bronchio-oto-renal syndrome. It is one of the most common cause of hereditary hearing loss. And preauricular pits are a sign of this disease. So it is important that when we see preauricular pits, we thoroughly investigate that case for BOR. Another condition is preauricular sinus. Preauricular sinus occurs due to non-fusion of the first and second branchial arch. First arch, tragus develops from the first arch, and the rest of the pinna develops from the second arch. So non-fusion of these two structures will result in a small sinus, that is the preauricular sinus. So it is present between the tragus and the rest of the ear. Due to non-fusion of first and second branchial arches, so the sinus tract can open into the parotid gland, it can open into the external auditory canal or elsewhere, and the treatment for this is exploration and excision of the sinus. And the treatment in general for all congenital anomalies of the pinna is pinnaplasty, that is reconstruction surgery. And it is mostly done for cosmetic purposes, as most of them do not cause any hearing loss except if there is a atresia of external auditory canal where hearing loss is seen. So it's generally done for cosmetic purposes. So this is about the congenital anomalies of pinna. Let us quickly revise all of them. First is anoxia, which is complete absence of pinna in ear lobule. Second is microtia, a small ear. Grade 1, small in size. Grade 2, small in size with some abnormality in the structure. Grade 3, there is just a vertical mass of soft tissue and cartilage. And atresia of external auditory canal is sometimes seen in grade 3. And grade 4 is complete absence of pinna, that is anoxia. And here I have a bonus point for you. One variety of grade 3 microtia is called as peanut ear. Just a bonus point. It's a fancy name. It is one of the variant in grade 3 microtia. Next we have macrotia, which is large-sized auricle. Then bat ears are abnormally protruding ears. And coloboma is a defect in the pinna. Coloboma is a defect in pinna that will result in a crooked helix. As you can see in this picture, the helix has become crooked because of this and the entire structure is disturbed. Cryptotia, upper 1/3 of the auricle is embedded under the skin of the scalp. Cup ear or lop ear, where the auricle is folded upon itself, it is because of underdevelopment or hypoplasia of the upper 1/3 of auricle. Next we have preauricular pits, which could be a sign of bronchio-otorenal syndrome. And preauricular sinus is because of non-fusion of the first and second bronchial arches. This is all about the congenital anomalies. Next, let us look into traumatic, inflammatory and neoplastic disorders of the pinna in the next video. Thank you.